Our topic of discussion today is regional injuries. In this we'll see different type of skull fractures. See, in this image you can see that this is the dura mater, and above that we have arachnoid pyometer, which are the brain meninges. Now if any trauma breaks this dura mater, then we call it an open head injury. If dura is ruptured, we call it an open head injury, and if the trauma just it is outside the dura and the dura is intact, then it is a closed head injury. So now, skull base versus skull vault. See, this over here you can see this is a skull vault, and below this part is a skull base. So now logically if we think that any trauma that occurs in this part can result in skull vault fracture, but how can a trauma cause skull base fracture, right? The skull base is protected inside the tissues. Any trauma from the outer peripheries will cause only what? Skull vault fractures. So we'll see how skull base and skull vault fracture occurs. See, the mechanism of skull fracture, whenever there is a direct impact, the direct impact by any rod, bullet can cause skull vault fracture. But whenever a person falls from height and lands on the feet, then you can see that the force is transmitted from feet towards the pelvic bone to the vertebrae and here the base of the brain. So from here the force is transmitted in the base of the brain. So this is indirect impact, and this will result in what? Skull base fracture. So now we learned how skull vault gets fractured and skull base get fractured. Now we'll learn in detail about skull vault fractures and skull base fractures. So the first one is skull vault fracture. This you can see, this is the fissure fracture. This is caused by a weapon which has broad surface area. So weapon with a broad striking surface causes the fissure fracture. And this is the most common type of skull fracture overall and causes thin linear fracture lines and general deformation of the skull. So now you can see here that there are just fracture cracks here, right? None of the segment is displaced or none of the segment is gone downwards. So in the next fracture, next one is depressed fracture. See, if you have this type of striking surface, then what will happen? This is the normal skull and the brain inside it. Whenever we use a hammer, the part of the segment gets depressed. So this is called depressed fracture. In the previous fracture we saw that there were just fracture lines over the skull, but in here a segment is depressed and it is compressing the brain. So which do you think is more dangerous? Yes, depressed fracture is more dangerous because it compresses the brain. So a narrow striking surface weapon is used and the fracture segment is displaced inwards. It is also called signature fracture. Why? Because whichever type of weapon we used, that type of segment is depressed. So the weapon is putting its signature mark over there, and it is causing complication like brain contusion, laceration and cerebral injury. So we have a injury in the brain. So now what is the management? See, in fissure fracture there was nothing like brain compression. Here there is brain compression. So we need to manage this fracture. If there is no intracranial injury or nothing has happened to brain, then we can conservatively manage it. But if there is intracranial injury present, then we need to surgically, see, we are elevating this segment. So surgically elevation of fracture segment is required. Okay. The third type of fracture is commuted fracture. See how this type of fracture is caused. There are, whenever there is one fracture, let's say there will be a one fracture lines, and if we repeatedly keep hitting the same part, then there will be multiple fracture lines. So this is called what? Commuted fracture. Now what are the characteristics of this? This fracture is also called mosaic fracture or spider web fracture. This part is looking like what? The web of a spider. Even here you can see there are no displaced segments. Displaced means in the previous fracture we say that the part of segment was displaced down. Here there are no displaced segment, and this is a complication of fissure or depressed fracture that we learned earlier. Okay, so now there is a Pupi's rule. What does Pupi's rule say? That let's say this is the first fracture line, it goes over here. Now if there is a second blow and there is a second fracture line, then it will not cross this first fracture line. Okay, logically we know that whenever there is a crack here, and this crack will not just overshoot and pass this crack. Now this third fracture line will not outgrow this second or first fracture line. So what is the use here? Use is, it is used for sequencing the fracture lines caused by multiple blows. So we know that okay, this was the first blow, then the second blow was at this place. So it is used forensically to get any clue or anything, right? And it is applicable to all skull fractures regarding the mechanism of injuries. Not only applicable to commuted, but all the fractures that we learned till now. So now we'll just revise about the name. See, commuted fracture was called mosaic or spider web fracture, while signature fracture is the depressed fracture. Just remember that whenever the segment is depressed, the weapon is putting its signature mark. The shape of it is giving on it, right? Okay. So the last one is sutural or diastatic fracture. See, here you can see that the fracture is along the suture lines. So whenever, let's say there is a blow here, the fracture line is along the sutures. So sutures are getting separated. Now in this image you can see there are two skulls. The first skull is having sutures while the second is not. Why? Because this is an adult skull. So the sutures are fused. In this skull, a child skull, there are sutures are still not fused. So this type of fracture is only seen in young adults and not in elderly. Right? The last one, see, now this you can see that this is not a fracture, right? This is just a depression. The depressed fracture that we learned earlier, the segment was breaking and going down, but in here there is, it's just a depression over here. Why it is caused? Let's say a child is undergoing a forceps delivery, and due to this pressure this type of depression is happening. This is what pond or ping pong ball fracture. Mechanism is trauma on the soft skull, because the skull of the child is soft and pliable, so it can cause this depression without getting broken, right? So it is a variant of depressed fracture seen in child less than 4 years and in obstetrics delivery due to the pressure of that instrument. Okay, the last one here is a gutter fracture. See, you can see this bullet, it is glancing at an angle and causing this fracture. So it is caused by oblique or glancing bullets. There are there are three types. See, this is the outer layer of the skull. We divide this into outer and inner table. Whenever the bullet comes and hits just the outer table, it is a type 1 injury. Second, it can hit outer and then inner table. And then third, which can go through here. So it's a keyhole defect, which is the bullet is going inside. So type 1 is outer, type 2 is outer and inner, and type 3 is keyhole.